अस्सलाम वालेकुम, वेलकम बैक टू माय चैनल। आज की इस वीडियो में हम डिस्कस करेंगे MCQs रिगार्डिंग हाइपरटेंशन। नंबर 1 MCQ is an obese 47-year-old man with hypertension comes to your office for a yearly checkup. He is 5 foot 10 inches tall, weighs 250 pounds. He smokes 2 packs of cigarette a day and drinks 12 ounces of whiskey a day. He is a truck driver and is on the road a lot. He frequently eats at fast food joints. On physical examination, you find his blood pressure to be 180. His point of maximal impulse is detected in the 6 intercostal space in the anterior axillary line. His fundoscopic examination findings are normal. He has no carotid roots. Select the following answer to the following question. Which of the following statement about this patient blood pressure is false? A इसमें wrong है. A single blood pressure reading of diastolic 105 is satisfactory for the diagnosis of hypertension. Number 2 है. Which of the following blood pressure values meet the criteria for initiating pharmacological treatment in hypertension as per GNC 8? तो B और C इसमें राइट है. 150/100 and 140/90. B and C ठीक है. A week later, the patient returns to your office with blood pressure measurements taken by his company nurse. They are as follows: 148, 144 and 140. At this time, you would prescribe, इसमें आएगा none of the above. Thiazide, beta blocker, calcium channel blocker, AC inhibitors. Okay, इसमें none of the above आएगा. Now 4. Which of the following first line pharmacological therapy now recommend for most patients with hypertension? इसमें B ठीक है. Thiazide diuretic, C a calcium channel blocker and AC inhibitor. Which of the following statement is false? इसमें false ये है D. Hypertension in older patient is best treated with calcium channel blockers. 6. Which statement is true regarding the use of antihypertensive drugs with other comorbids? इसमें D ठीक है. A and B. The initial diagnostic workup of a patient with hypertension should include which of the following? इसमें A भी ठीक है, B भी ठीक है and C. Based on the patient history and physical examination, which of the following statements concerning his hypertension complication is most likely true? So C ठीक है. This patient is likely to have cardiac hypertrophy. Now 9. Which of the following statement regarding the treatment of hypertensive emergencies and urgencies is false? Or all of the above. The patient is admitted to the hospital a few months later for an acute cardiac infarction. He has disregarded your previously prescribed therapies. What medications would you now prescribe for his blood pressure? The average 160. A and C ठीक है. इसमें metoprolol and lisinopril. Now problem 2. A 50-year-old man with resistant hypertension. A 50-year-old man is being treated for hypertension with a low salt diet, hydrochlorothiazide 25 mg per day and propanol 120 mg twice daily. His blood pressure is currently 180. Which of the following would be a reasonable third line agent for the treatment of this patient's blood pressure? Is enalapril. What is the most common side effects of AC inhibitors? तो इसमें कफ होता है. 14. Which of the following prescribed consideration concerning hydrochlorothiazide is true? E. Its use should be avoided in patients allergic to sulfonamides. Based on the history and physical examination of the patient described in the clinical case problem, which of the following added investigation should be undertaken? The correct है echocardiography. 16 is which medication should be least optimal in a patient with asthma? तो propranolol है. Which antihypertensive medication is best avoided in chronic kidney disease? Is D. Which medication is contraindicated in gout? Hydrochlorothiazide. Now problem 3. A 49-year-old obese postmenopausal woman with type 2 diabetes The next day, the wife of the patient described in clinical case problem 2, a teacher sees to you in your office. She is 49-year-old, postmenopausal obese woman with type 2 diabetes. She brings in a record of blood pressure taken by the school nurse during the past 3 months. The blood pressure readings average 136. Your approach to this clinical problem case may be which of the following? A and B. Recommended lifestyle changes and return visit in 3 months, and B. Prescribe lisinopril if her blood pressure is unchanged in 3 months. उम्मीद है लेक्चर आपके लिए हेल्पफुल रहा होगा. थैंक यू सो मच.